It's been we just stopped. We started short of 2 years since we've been on this podcast, which is crazy because obviously so much has happened at HIDEF since 2 years ago.
Yeah,
I
what was our
mean,
last episode? What was it about?
oh man, what was the last episode? I know our highest performing one was the one with Luca. So
Oh,
if
really?
you're jumping back into HiDEF Performance Podcast and you missed the one with Luca, that's a great one. We went on a crazy tangent. I actually had to stop him at the end of that because he was like just plowing through other meetings that he had on his schedule, and he was just continuing to go through like no cares of the world. We were just talking deep into training and stuff like that. But yeah, it's crazy because I looked at like the history of the HiDEF Performance Podcast, and we've been going for a really long way. Oh yeah, so the last episode was actually Halloween 2024, streamlined rehab programs designed with the P5 framework. So we were kind of just talking about the P5 framework, but since 2 years ago, we've opened 2 clinics. We've probably doubled, like maybe 300% increased in size. And so, HiDEF looks a lot different. We just opened a 6,250 square foot clinic in Covington, 40 yards of indoor turf. Like the idea and the model of what HiDEF started as is now continuing to expand and really just reaching its full realization and really not even close to full potential, which is super exciting for me because I'm like, like we always dream when we first talked on this podcast, when it was first its own thing, it was like the idea was like, oh, let's create like the centers for performance and physical therapy all in one. And it was like this pipe dream, but now this is, come true with our own massive warehouse style facility with the turf and like a full collegiate / like professional weight room setup. And like, it's kind of cool. And I think through the last 2 years also, we've learned a lot about ourselves and about HiDEF and like our differentiators, and we've leaned into those strengths. And so we are going to be bringing back the HiDEF Performance Podcast. The goal is again, like we were back in the day, super consistent with our podcast. I mean, we're doing them like, weekly, if not multiple times a week, putting out those podcasts. And so that's our goal here. Hopefully bring in and spotlight some providers in our company, experts in the field, and just really get back into the swing of like, what made HiDEF Performance Podcast so cool. And so that's kind of the goal. And this is the kickoff episode. So where should we start?
Man, I think a cool place to start would be just talking about how to go about finding someone like us, because I think the tricky part with physical therapy is, I don't come from physical therapy, so it's interesting to think about how I would go find a clinic, and I want like everyone else to understand like how that process would look and how you should go about things. Because, what's it going to start with? Oh, man, I've been playing a lot of basketball. My knee's kind of hurting. I'm going to search maybe physical therapy I should search. Okay, I'm going to go to Google. And, every link kind of looks the same. They just have different names, right? And maybe one even says sports in the name. Well, shoot, sports, I'll just go there. You schedule. It's in a hospital building, or it's in this 1,000 square foot office space with carpet and a table, and like you talk about like why that is just not going to get you the same result as a space like ours, and then also how someone could find us in that process and not make that same mistake.
Yeah, I've been thinking about this a ton lately, and I was actually like up late yesterday working like at 9 p.m. I was like Googling physical therapy clinics, and then from the map view, I was trying to see like, what do people see when they try to search for us? And like that, I'm trying to figure out like, what do people actually look for? And I think the first thing is like, if you search somebody, look for reviews. Like you need testimonials that people have had good success. And, you know, like you can go and read our reviews. Like we have a 5-star rating throughout all of our clinics. We still have like 2 and 3 and 1-star reviews out there. Cause like, unfortunately, even though we try our hardest with the amount of customers we serve, sometimes like something's going to happen. And so it's really good, one, to read the good reviews, but also the bad ones. And then how does that company respond to those bad reviews? And like, are they actually taking steps to fix those things? And then, you know, the second thing I do is I look at photos of the clinic. Like I try to get an idea, what does this space look like? Does it look like the type of space that is going to facilitate what I'm trying to get better at? So if I'm, you know, a runner, do they have space to train runners, right? Do they have the weights? Do they have kettlebells? Do they maybe have a treadmill or something like that that I can work with? And then, you know, I'm always going to the website. Hey, let's read what, you know, and unfortunately, like when you go to a website and you look at like the treat, like what we treat section, and same with the naming, right? Like you made a good point there. Just because you call yourself a sports clinic doesn't mean you're a sports clinic. And there's no rules that stop you from putting sports in your name or even putting something on the website, right? Like we call ourselves an ACL specialty clinic. There's nothing that prevents any other clinic from putting that up there, but it's like, are you getting real results from real people? And like when you go and read our reviews, you're going to see like people talking about, I went to HIDEF after I tore my ACL. I got such a great result. Here's me going back to sport. Or like even reviews where it's like, I went to another physical therapy clinic for 6 months for my ACL. I didn't really think I was getting the stuff that I needed. And now I'm at HIDEF and I couldn't be happier. And so like read those testimonials. Actually, don't just look at, hey, 5-star reviews, because people get fake reviews out there, right? Like you go and read the reviews that people are putting in and you'll see like at great clinics, people are leaving paragraph reviews. Those are people who are motivated to actually leave the review versus like, you know, someone asked them or someone paid them to do the review. Right. So I look at that. And then, you know, like there's a variety of other factors, like looking at the therapist within the clinic. What are their certifications? What do they study? Have they worked with people like me in the past? Cause like I always tell people, like you go see a surgeon, you don't want the guy who's like, does like 5 ACLs a year. You want the one who does 100 ACLs because they're just going to be better from doing more. And so I'd say like, you know, for us, the population we serve tends to be in like the 15 to 65 range. Yes, we are in network with Medicare, so we see Medicare patients, but like I'd say the average patient age of our like in our clinics is somewhere between 35 and 45. Like it's like right there in the middle. And so we tend to skew to a younger population. We tend to skew to a more active population. We tend to see a lot more athletes and people who are in sports. And we do a lot more what I would call like performance rehab, which is different, right? So when you look at like the average physical therapist clinic, they specialize in things like motor vehicle accidents, labor and industries, injuries, AKA like chronic low back pain, low back injuries, those kind of things. And then, you know, like chronic conditions, you know, chronic pain, fibromyalgia, you know, like total knee replacement, hip replacement, things like that. And although we get a little bit of that coming through our clinic just naturally as an outpatient clinic, we are much more focused on the active individual. And that shows in like the clinics. Obviously, like you take a look online, and anyone who's listened to this who's been in a clinic knows that it's like way different when you come into one of our clinics versus other clinics. Like you walk in and you're like, oh, am I in a gym or am I in a physical therapy clinic? And that's a lot different than like the feel of like going into a clinic with like low drop ceilings, carpeted floors. And like even our Bellevue clinic, which was our second standalone, where we weren't necessarily going as far this direction. We've done every single thing we can in that clinic to make it more and more sports related, right? We have 2 Rogue squat racks mounted to the walls. We've got like the multiple sets of dumbbells and kettlebells that go heavy. We've got a trap bar in there. Like we've done, and we got force plates. Like we've done everything we possibly can within that clinic. And that's probably like the clinic that's like been the toughest space wise to manage, but like we've done everything in our power to make that a sports clinic. And then obviously like all the future ones are the space really matters, right? And so I think like if you're going to go and try to do rehab in a place, and just because it's small, that doesn't necessarily, isn't a game changer. If you have treadmills, if you have heavy weights, squat racks, you have trap bar, if you have all that kind of stuff, you can get so much done. And then you might need to transfer over to one of our other clinics if you're going to be high speed sprinting, agility work like that. But the fact of the matter is, most clinics don't even get people to the level where they're actually lifting more than maybe 25 or 30 pounds. And so in our clinics, we have people squatting 400 pounds, right? So because we have the weight there. And to me, why we built this whole thing and it's really come to fruition is and because I felt this as an athlete, right? When I got done with PT, when I was an athlete, I was like, there was a gap. And I went to a guy who specialized in taking people from physical therapy to back to sport. That was all he did. You graduated PT, woohoo, success. Now you have to go see this guy and he's going to train you back to the level that you need to be at to return to sport, because usually there's a really large delta between when someone finishes PT and when they get back to whatever, right? If all you ever done is clamshells on a table, some single leg bridges, some press ups, and you're going back to tennis, there's a very large delta between what you've been training to do and what you're trying to do. And so what we've done through investment into our PTs, education, investment into the clinics, investment into the space has been, hey, let's get these people all the way 100%, and not even just 100%, but a lot of the athletes I'm working with and active individuals, I should say, by the way, when we say athletes, we don't just mean oh, you are a team sport athlete. We mean you just like to do activities, right? You're not just at home sitting on the couch all day. You want to go out and do stuff, whether that's it sounds cliche, but whether it's hey, I'm going to go out and garden for 2 hours, or I have to mow a 1 acre lawn, all of that stuff is activity. And if all you're doing is clamshells and body weight squats, you're probably not going to get the endurance and strength needed to get back to those activities. And so we've made all of those investments in our staff, our knowledge, the knowledge of our staff, the training, the people we recruit, the spaces, the equipment, all that stuff, to make sure that we close that gap for people. And most of the athletes that I'm working with, they're actually doing more training and they're in a better place than they are when they came to me. So I get so many, even collegiate athletes, it's always mind blowing. Like Mitch, I was just working with a soccer athlete and I'm like, do you guys normally train this hard and this well? I'm like, no, he's literally I'm stronger than I've ever been. And by the way, just got athlete of the week within his conference of soccer, went from almost catastrophic knee injury with a team we work with to now he's just absolutely crushing it. They're at the top of the table for their college. And that's the kind of stuff I'm like, wow, that's amazing. We can even work with these really high level athletes and we could still have more to add to them. And that's something that I'm most proud of at HIDEF here is there's not a lot of people that can say that where, hey, we have more to add to the professional athlete. A lot of clinics or clinicians, they'll get a professional athlete and they're like, I don't even know what to add to this person. Right. Like we have professional WNBA players, NBA, NFL players working with us. We've got MLB players. We were just gotten off a call getting an MLB player in. And it was cool because I was also talking to I can't remember who I was talking to in our company the other day, but they were like, I already love it now that I'm in this company. I love how you guys have taken the idea of treating, it was Zach Collins, treating professional athletes, but not only said, hey, we're only going to treat professional athletes this way, but we're also going to now take this same mindset and bring it back down to anyone in the general population basically has access to providers who are capable of treating pro athletes and get back to their function. And so that's why also we have such a high success rate. And I think high 5-star reviews is because if you're prepared well enough to get, an NFL linebacker back to, return to sport after a knee injury, and they're going to be, trying to tackle a 230-pound running back who squats 600 pounds. And you have to be able to get them to sustain that amount of force. It's
you can get me back to pickleball.
Exactly. And so that's what I think about. It's our capacity is really high, and we get a lot of people, coming from other clinics. And it's not to knock any other clinic. I think every clinic exists to serve patients, and each clinic has their own unique population that they specialize in, but every once in a while, someone gets into a clinic that's like they're kind of out of their league, and people feel that pretty quick, and that's the other thing I'll add to this like as I finish up this soapbox rant. Thanks for listening. Like once you get into PT, you don't have to stay there forever. Like if you get in and you're starting to sense like, man, these people might not exactly be the right setup for me, or even like maybe they took you through your first 10 visits and you feel better, but you're like, they might not be able to take me from here to the finish line. That's why I'd always look and figure out, like, because you got to find what's best for you. I'm confident from our team's perspective that we could take people from day one post-op rehab or day one injury all the way back up to the highest levels of sport and competition, and anyone in between. But just because you make a decision doesn't mean you're locked in, right? Like a lot of people get that like investment bias where they're like, oh, I already did all the work to get in here. They verified my insurance. Like it's easy to switch. We do free verifications for people for insurance. It's not hard to do.
Yeah. And I think that one of our advantages is that we take pride in getting people on our team to a point where they don't feel in over their head. So you could kind of guarantee that you're going to come in and anyone that you see is going to be ready because they are seeing a high volume of these types of people. I think that's probably sometimes the issue at other clinics is maybe they never see ACLs. So then once they, you just Google searched, went to this clinic and it's like, yeah, we do ACLs. We do them not very often, but we do them. And it's like, yeah, but like you said with the surgeon, you'd probably rather go to the place that sees 10 of them a week than the place that sees one a quarter. What I want to,
anyone listening to this, the reason why we talk about ACL so much is because ACL is probably one of the most understood. Like a lot of PTs are confident they can treat it, but it's like one of those like Dunning-Kruger effects where like you don't know what you don't know. And when you start to research what good ACL rehab is, you start to go down this tunnel where like, if you're a really good provider, you even start to think like, dang, am I doing a good job at this? Because there's so much that goes into getting an athlete back to ACL. Like someone commented on a post the other day and was like, there's no need to strength test post-op. I'm like, this guy is so far up on Mount Stupid of the Dunning-Kruger effect, because like, if you don't think you need to strength test an ACL post-op to get them back to sport, you have literally not read 1 inch of research of ACL, because like we know that lacking quad strength is the number one predictor of re-tear of ACL. So it's like, if you don't test it, you're guessing. And it's like, if you're just looking for them to pass a functional test, like we talk about all the time, there's been so many times where I've looked at an athlete, I've seen them squat, I've seen them move, and I'm like, oh, they must be pretty symmetrical. You test them and it's just like the force output is not there, which means when they get put in a position where they can't compensate and in a controlled environment, do like an FMS test lunge or whatever you're trying to do, or drop off a box, it's like the eye test is fake. Like you can't just look at someone and know. Like I had an Achilles rehab in the other day, and he showed me a squat. And I was like, oh, you look like you're putting 50% weight. Let's just check it on the force plates just to be sure. Sure enough, we put them on the force plates, 77% to 23%. And it, to my eye, and I've been a physical therapist more than a decade, I look at this guy, I'm like, looks 50-50. Put him on the force plates, not even close. And so it's like, it's just every day I test people and I'm surprised one way or another. Sometimes I'm like, oh, you're going to be so weak. And it's like, whoa, super strong. Let's go to the next phase. Sometimes, it's like, and it's not that the strength testing is the only thing, but it is like, it's like you're testing and you're not guessing. Like we have to know that you're force outputting what you should be.
We'll talk about some of those stories of those athletes, right? Where they like have gone somewhere else for 6 months and then they seek out another opinion, right? Like I can't remember some of those athletes, either you saw them or someone else saw them and talked
so many
about
times, man. I mean, we've done a bunch of them, and it's kind of like an epidemic of it. And luckily now we have local physical therapists who actually referring their patients over to us specifically in order to like do the testing. But yeah, we get this all the time where it's like someone comes in and it's like, yeah, I've been doing rehab. So this happened to a youth athlete, basketball player, has been rehabbing. And then their PT was like, all right, you're good to go 6 months in, right? Like, hey, you're good to return to sport. That person went back to their doctor and the doctor's like, this can't be right. Like, this doesn't sound right. It's only 6 months. Hey, can you guys do a little test for this person? And sure enough, we test him and he's under 70% limb symmetry index. And not only that, but he's not even close to like the cutoffs you would need for return to sport. So for us, it's like the average person walking around has 3 Newton meters per kilogram of force output of torque of their knee. And so like this person was like mid 2s. And it's like, man, if that person would have just gone back to sport, their re-tear rate was so high. And it's part of the reason why I think like, you know, we wonder why re-tear rates of ACLs are going up. And I'm like, I mean, I don't want to blame physical therapy because I love physical therapy and physical therapists, but I think we're part of the problem if we're trying to clear athletes at 6 months post-op ACL, because we just know via all the research that's out there, like that is not a good strategy for health, right? Like we know that every month past 10 months, you are way less likely to re-tear your ACL every month you delay. And we also know now via the studies on the biology of the ACL graft that recellularization of that ACL graft is happening up to 18 months later, and maybe even longer, and meaning that ACL is only getting stronger and stronger over time. So if you're returning it at 9 months and it's halfway to its full recellularization, like theoretically you're increasing the risk of that re-injury. And also you're just giving people more time to train and get strong. And so like, again, we use data through strength testing, hamstring quad testing. We use force plates data. And then we also use like the standard battery of tests where a lot of PT clinics aren't doing, right? It's like, can you accept this amount of load? Are you able to like transfer and change directions? Are you able to single leg hop for a certain amount of distance equally on each side? And like all of those different tests that are super important to do, those are still part of our battery of tests that we do with our athletes. But it's like, you know, another story, you know, of our partner clinic, it's like collegiate basketball player was like, transferred schools. Hey, I'm ready to return this. Hey, been doing great. ATC from the previous college. Oh, they've been doing awesome. They're going to be ready to go. Get them in test. It's like under 2 Newton meters per kilogram, 40% limb symmetry index at like 8 months post-op. And you're like, whoa, this is crazy. Like this guy's not even gonna be able to jump and land. Like if this guy tries to go for a layup and tries to land on that 1 foot one time, his knee's just gonna collapse. He can't even like put out enough torque to support his body weight, let alone imagine landing from a dunk off the uninjured side. The amount of force that's going through the landing is going to be like 4 or 5, maybe even 8x the force output of like your body weight. And so that's why all this stuff matters. And you can extrapolate this. It doesn't even matter. You can extrapolate this out to other injuries, right? Like we have so many friends that have torn their Achilles lately playing basketball. If I tore my Achilles and I wanted to go back and play soccer or basketball, I'd want to make sure that my strength was back at least within 90% of the other side before I return to sport. And I want to make sure that I have a certain amount of strength to body weight ratio based on my weight, right? Because like if I have 200 pounds of force and you have 200 pounds of force, like I weigh a lot more than you do. And so like I should be able to produce more force because at the end of the day, my Achilles has to support my body. And so if I don't have enough strength to body weight ratio on that, then there's going to be a problem. And so like, not only do you need like the force outputs, but you need like how much torque to body weight ratio you're producing is going to be a huge factor for all of our rehab potentials. And it's not just ACL. Again, we talk about ACL because it's the easiest one to extrapolate because it's a very known, like it's about 12 months. So it's a long rehab. It's a year. We have known phases of recovery. It's a little bit more predictable than some of these other like injuries that are out there. And so that's why we talk about that a lot, but you can extrapolate this out to rotator cuff, even like a common tear in women who are in their 50s, like glute medius tendon rupture. Like you can extrapolate this to all those conditions.
Well, what are some, aside from re-tear, what are some of those other risks or issues you're going to run into if you don't get the right care for those injuries?
I mean, it's going to be other types of injuries in that same joint for sure, and then other injuries of other areas. Like I'm very convinced that once I sprained my ankle a bunch and I never like adequately rehabbed it, I started to pass a lot of the force to my knee. Because like, think about like, for example, with a knee injury, what we find is, and what traditional physical therapy tends to work on, and it's like this weird thing we've done for a long time, and it because of a couple studies that came out and that have been proven wrong, but it's like we work the heck out of the hip. Like you have your knee injury, we're like, oh, your knee collapses inward when you squat, that's what's causing your knee pain. We got to work on hip abductors, clamshells, all this stuff. And not that like hip strength isn't important, but if you look at someone who has chronic knee pain and you test the strength of their quad and their hip abductors, they'll have a weaker quad on the injured side and a stronger hip abductor on the injured side. Meaning, if I have right knee pain, most people have 10 to 20% increased strength of their right hip muscles. And it's because they've taken all of the load that the knee should be using. Like you're going downstairs, your knees should be taking that load. Well, they start to compensate their mechanics so that their hip loads. They do more hip hinging, right? So when they squat, instead of staying upright body mechanics, they start to lean forward more, which shifts weight back to the hip, and the hip gets stronger. And so we, like a lot of PTs, we work on the wrong thing. We work on this hip strength, but it's like we need to work on knee strength. So then what happens is when that person finally gets into a position where they have to go downstairs and they can't shift back to their hip, their tendon isn't ready and they get tendonitis or tendinosis or tendinopathy or whatever. They start to get knee tendon pain, or they start to put more strain on the meniscus in the knee with like cutting and whatever, because they can't support, right? They're collapsing more. They're getting into deeper knee flexion angles because they can't maintain knee extension at planting or at landing because they don't have enough strength to absorb the force, or it just gets passed up to another joint, right? Like the hip starts to become painful.
Those are those hidden issues that maybe someone just associates with getting old, when really it's like, no, we could point that back to just not getting the adequate strength that you needed with the first injury. And maybe you could avoid a lot of those things, or delay a lot of those things. So that's
and here's the big one, man, is like, I had someone in the other day that was like having left knee pain. And I was like, left knee pain, tell me about it. Oh, it started 6 weeks ago. Usually my right knee hurts way more. Like for the last 3 years, my right knee has always been the problem. I don't know what's going on. Now my left knee is the problem. And I'm like, okay, let's test that. Well, turns out the left knee was still stronger with force output than the right knee. But the left, it was really interesting because I think what had happened was his right knee was such a problem that he actually started shifting all of his force over to the left knee. He started getting tendonitis because his right knee pain got so bad. And that's what basically the story ended up being. It was like, man, my right knee got so bad. And then all of a sudden it was a lot better, but my left knee started hurting. It's like, oh, you just took all the weight that you were doing, anything on, like squatting, going downstairs, all that kind of stuff. You shifted it to the left knee, and now your left knee hurts, and it's like killing you. And so what do you know? We started retraining his right knee, and it made the left knee pain go away because he no longer had to shift the load over.
And you're saying without testing it like that, maybe you would never really come to those conclusions, right?
Yeah. Oh yeah. I would have just been like, oh wow, that's interesting. Let me just train your left knee. But it's like these crossover problems, especially with lower body. Like if you have pain on one side, you're just going to start using the other side more, and it's just going to cause that load to shift, which can cause increased injuries over there. So it's an interesting thing that happens. And when you start to test, you start to find all these things. Because again, I used to just always assume that people with right knee pain also had right hip weakness, because that was what I was told in school. I was always told, hey, like this person must have, like the only way is like they have core weakness and they have right hip weakness, and that must be what's causing their knee pain. Like their knee isn't to blame. But it's like, no, maybe the knee is to blame, and the hip is actually taking a lot more of the strain and force. And then eventually what happens is you have knee pain long enough, you start to get hip tendinopathy because your hip's doing so much. So you started shifting so much load there. Now you got a hip problem. And like, it it happens. And I think we like sometimes blame other joints for the problem, but it's like, no, maybe the problem actually started in the knee and you have to actually address the knee. Cause like a lot of rehab, when we talk about like holistic rehab, people are like, we treat the whole body. For a long time, what that meant to me, and now that I look back at it, not that it meant this to me, but now when I look back at it, what it looks like is like, oh, let's just ignore the knee and treat everything around it.
Right.
That's holistic treatment is like, I'm going to treat your hip. I'm going to treat your ankle. I'm going to treat your core. I'm going to treat your low back, but I'm never going to do open chain or closed chain knee extension exercises because that's quote unquote painful. But it's like everything's about load tolerance. Like if you have a tendon problem with like, people will say this all the time, like, oh, every time I go hike, my knee hurts. It's like, okay, that sounds like a load management issue. That sounds like your knee can't take the load. What have you been doing knee strengthening wise outside of hiking? They're like, no, never. I don't do it because it's bad for my knee. You're like, okay, using your knee is not bad for your knee. Otherwise, hiking is bad for your knee. You know, it's like, it's not inherently bad. It just means that like when you go for a 2-hour hike, your knee is not adequately ready for a 2-hour hike. And so you have to do something throughout the week to gradually increase your load over time so that your load tolerance goes up, right? Because like in this could be, I think we should do a whole episode with this new series on like load management and like Tim Gabbett's research. And like Tim has become a friend and like has just done so much influential stuff in sports.
We had him on the podcast.
I know. We did. And I didn't like, oh God, it's just like one of those things where like, even like how I practiced 5 years ago is so much different than today. And it's like, I'm part of the Dunning-Kruger effect on different things. And like, I just didn't know what I didn't know about load management. And since we've had him on the podcast and we took his course and I've done my own deep dive research, I'm like realizing like, wow, I was really an idiot on load management. And now I'm not as much of an idiot. I still have so much more to learn and like in everything. But I could talk about it in such a different way. And honestly, I would love to have Tim back on because I can ask so much more informed questions versus how I used to ask questions.
So don't listen to that episode is what you're saying.
Yeah. Don't go back. You know, like honestly, like any episode like 2 years ago and back is probably trash. Besides if you're listening to a guy like Luca, like, you know, like don't listen to me. Now, Tim knew what he was talking about. So maybe I didn't ask the best questions, but Tim still had all the knowledge in the world back then. So if you're going to listen to it, just ignore how bad and misinformed my questions are. I guess for the layman's, it's not going to, it's like if you're a PT listening to this, it's going to be a little more brutal for you to listen to the questions that I asked. But if not, yeah, I think you'd be fine.
I think that's another differentiator though, is like, you see a lot of clinics with PTs who probably are just doing the same things from 20 years ago, whereas we're changing things at the rate as the research. Like we got a guy, Tony, who like he'll quote research articles that just came out, and I don't know many people else that are like that.
Yeah, I mean that's a great point because like we've just got such a young I mean, literally at this time of the year, it's October, so we only have 3 months left in the year. We're having this issue, which is usually not an issue inside of a physical therapy clinic, where everyone's gone over their Con Ed budget for the year, but everyone still wants to take courses. And so it's like, it's hard because like we're having to be like, okay, can we do this for this person? Usually people are like struggling to spend their Con Ed budgets. They're like, for those of you guys who are not PTs, like every 2 years, you have to do a certain amount of hours of continuing education as a physical therapist. And most physical therapists, what they do is they'll buy like what's called MedBridge courses, which are like these really boring online courses that you can just skip through the videos and you get all the credits. So like your PT, even though they might be satisfying their CEUs, they're really just like doing these BS courses. I mean, I'll be honest with you, like it's crazy. Yeah. Our company doesn't do that. We don't allow MedBridge. We got rid of it quite a long time ago for that reason, because we want our PTs to actually go do like legit, like good courses. And it's become like really part of the culture of like, is like learning. Like we've got a bunch of cool courses in sports concussion management, and Eric Mira is coming in with the knee science course. And like, we got like so many cool things like that. But, you know, like all of our providers, I think in our company can look back and go like, wow. And you almost feel ashamed, but not in a bad way, but like in a good way where you're like, man, I wish I could have treated all those people that I treated 5 years ago right now with what I know and the tools I have, because I've just gained 5 years of experience and there's only so fast you can learn. So not only are we expanding our treatment style with the research, we're also just expanding it with the speed at which we can learn, right? Because I wish I could just like download all of the information that's out there, but unfortunately it takes time and effort to download all that information. And so the providers who have put the most time into downloading that information, you know, can do really well for themselves. And it doesn't necessarily mean that a PT 10 years out is going to be better than a new grad, because the new grad is like ferociously devouring like shelves of books and courses. They're going to have way more knowledge than the PT.
Well, the research is changing, right? Like,
yeah, for sure.
Things change. Like you said, you were treating based on what we knew, but now we know differently. And if you're not caught up, you're not going to change anything.
And for most PTs, I can tell what decade you came out of school, because I like based on what you do and how you believe, because most people have this like sunken cost fallacy. And I've really, really battled to get rid of mine, where it's like, I paid 100 grand, 200 grand, whatever you paid for PT school. That information can't possibly be wrong already 10 years later. And then you've got to hold on to that because like you spent all this money getting it. And it's like actually a true like known fallacy is called the sunken cost fallacy. And it's just basically like you're just inclined to believe something you spent a lot of money for. And that's like how this stuff goes downhill, where it's like, I'm actively learning stuff right now that goes against the things that I paid a lot of money for to learn in school. But someone very smart that's done a lot of research. And it's not just like, we don't just change our ideas with like, you know, like the drop of a hat. It's like, we actually do the hard research to look at like, does this actually make sense? Is this something we should actually change? And if it is, we have to make the change, right? Like you can't just do the things that you've always done. And, you know, there's something to experience, but there's also definitely something to just learning more and more, which is why like every skills lab we do, every course we bring in, every Wednesday, like every other Wednesday, our company meets up and does these, like we call it studies with buddies. It's like, we are consistently committed to learning and growing our skills and knowledge. And it's an endless pursuit till you're done being a PT, because you'll just never stop learning. PT is a relatively new profession anyway. It's like really came about in the 70s, like on the scene a little bit before that. But it's like, if you think that in 2000, you learned everything that was to be known in PT after a 30-year profession, it's like, dude, there's people in finance that like, you know, Wall Street has existed since the beginning of the formation of the US, and same with like engineering, whatever. We're still learning stuff, right? Like it's just like silly if you've hung your hat already. And so that's like one of the biggest qualifications for us, for our PTs, is like, you can't have hung your hat. Like you have to be actively trying to improve your skills.
Yep.
Nice, man. I think that's a great pod for the start out. We've got a lot of exciting topics. I have so much stuff I want to do on HIDEF Performance Podcast. Like I said, we've been head down for the last 2 years, grinding out the business side of things. And so our goal is to just bring in all the really cool providers that we have in our company, start getting some other voices in here, experts in their fields. We've met a lot of cool people that could come on the podcast now that we didn't know back then. So I think it'll be awesome to look at.
For sure.
And that's the pod.